Hello everyone and welcome to another day of high yield USMLE questions. Today we will be talking about pulmonology. 22-year-old male presented to the office due to headache and dry cough for the past 2 weeks. He also complains of mild fever and malaise. He noticed a rash on his body recently. Vitally, the temperature is 99, slightly high. It's not that high, it's just slight fever. And then we have a blood pressure, which is normal. Pulse is 75, which is normal. Physical examination is unremarkable, except for vesicular rash on his arms and extremities, which means legs. Chest X-ray shows bilateral interstitial infiltrates. Labs are as follows: hemoglobin is 11, just mild anemia, and Coombs test is positive. So, what's the most likely diagnosis? So here, if you look at this patient is having some sort of pneumonia going on, but the pneumonia is very mild. So when you think about mild pneumonia, one thing that comes to mind is mycoplasma. You need to know some manifestations of mycoplasma that are outside of the lungs, which include Coombs positive anemia, which is usually just subclinical, which means that there is no sign and symptoms of that anemia. So Coombs positivity will be there. You get the Coombs positive, and that is the cold agglutinin, IgM. So starts with M. It also starts with M. So also there is another thing if they ask that is also Coombs positive, and that's infectious mononucleosis. That also has M in it, infectious mononucleosis. So that also has IgM. So both of them have M in their names, and both of them are associated with cold agglutinins or IgM. Another thing that mycoplasma is associated with is a rash. They will usually share a rash. They can say macular, they can say vesicular. Also, they can use a word for it, erythema multiforme. These are just target type lesions, which you can see with herpes. They are also seen over the entire body. In someone with mycoplasma, you can see those as well. So they're target like rash. All right. So the answer here is obviously, I told you, is the mycoplasma pneumonia. Usually these patients are young. There is bilateral infiltrates, usually interstitial infiltrates. The patients have usually the cough is very important here, because usually the clinical features include cough, and the cough is dry and really persistent, and usually young, bilateral infiltrates, and the patient is not the onset is very indolent. It's not abrupt onset. So listeria, wrong answer, usually does not cause the pneumonia. Chlamydia pneumonia may cause pneumonia, but here the rash, here the Coombs positivity goes more towards mycoplasma. Then Staph aureus. Remember, Staph aureus is important. This will be very abrupt pneumonia, and usually occurs after a viral infection, an influenza viral infection, for example. So pneumonia following a viral infection, or influenza viral infection, or flu infection. Think about Staph aureus. It's very destructive. It's not indolent, so it occurs within days or hours. Very, very destructive. So high yield after flu virus infection. If there is a pneumonia, think about Staph aureus. That's very, very destructive. Influenza virus, wrong answer. Remember, it would not last for more than 2 weeks. Usually the symptoms resolve within 1 week. Strep pneumo, really abrupt onset, usually lobar. Wrong answer. That is also the wrong answer. So usually abrupt onset, very high fever. Another thing is if they say pneumonia symptoms plus there is like GI symptoms, for example diarrhea, or they say confusion, think about Legionella. So important as well. So hope this video was helpful, and if anyone requires tutoring, they can email me here. And if this channel helps you in your USMLE prep, you can support the channel here. Thank you for watching.